Welcome to Penn Nursing and welcome to Penn. My name is Mary Ann Smith and I work in the School of Nursing, and I'm very pleased to have this opportunity to speak with you. There are so many exciting career opportunities with nursing, but I am sure that when you mention the word nursing to family and friends, they may have this reaction. Nursing? Why nursing? Why not medicine? Why are you settling? Well, the best advice that I can provide to you is forgive them. They truly don't have a sense of all the opportunities that you can do with nursing. Let me give you a few examples. One, you could be a nurse practitioner and have your own private practice, diagnosing, prescribing medication, admitting to hospitals, or maybe you prefer working in a hospital setting and you could be a nurse anesthetist delivering anesthesia, or possibly you may want to work in the administrative or the consulting or the management part of healthcare. In fact, the two major hospitals that are on our campus, the University of Pennsylvania as well as the Children's Hospital of Philadelphia, are both in the top 10 medical institutions in the country. And guess what? The two chief executive officers of both those hospitals are nurses. So you see a different way of looking at nursing. Or maybe you'd want to do something completely different, maybe possibly research. Well, here at Penn Nursing, we encourage our undergraduate students to join our faculty in research. And in fact, Penn Nursing is the #1 school of nursing for research in the country. But there are many other opportunities. Maybe you're interested in public health or possibly healthcare law. And again, all these opportunities are available at Penn within nursing with an undergraduate degree going on to some type of an advanced degree. And we are here to advise you and counsel you and guide you along to whatever your ultimate goal for you to be professionally, we will help you attain. Now, a little bit about Penn Nursing. First of all, remember, you are admitted to the University of Pennsylvania choosing to major in the School of Nursing. Now, we treat nursing as a major. It is not a way of life here at Penn. There's no nursing dorm, or your friends and all your activities won't be evolved around nursing. You will never be told that you cannot participate in any of the 500+ clubs or activities. In fact, we have quite a few Division I athletes in our nursing program. So you could have a roommate who may be a history major, and you will never, ever be limited to not being able to do every single thing that history major can do. And I will go into all the opportunities a little bit. Our curriculum is a blend of science courses, clinical courses, which would be your direct patient care, and a very strong liberal arts component blended throughout all 4 of your years. To give you an example, we have a 4-semester language requirement. So you have options. You could continue in the language that you've been taking in high school and maybe pursue it as a minor at Penn. You may choose to place out of a language requirement if you're proficient in a certain language. Or you could choose from the 40 world languages that we offer here at Penn, in addition to Spanish for medical professionals as well as American Sign Language. So you have all these opportunities. But let's go through the curriculum so you can have an idea of what to expect and what this program looks like. So next slide. Okay, this will be our 4-year curriculum. All right, so again, this will show you our fall and spring of your first year. And as you notice, you can see the nursing courses as well as the liberal arts courses. Wherever it says sector requirements, that's where you choose to do something, outside of nursing, and you'd have to fulfill history requirements, arts and letters, math, global health. There's many different things to fulfill those typical sector requirements. We would start your clinicals, and again, as I mentioned, when I refer to clinicals, we're talking about the spring of your second year here at Penn, where you will actually be in the hospital delivering clinicals to people. However, prior to that, in the spring of your first year, you will be in our technology center developing your skills and your confidence working with our simulated people. Now, I'm sure some of you know what our simulated people are, but for those that may not have the knowledge, just think of a mannequin. But a mannequin that is so close to lifelike as possible. However, they are computerized, which means they have all the vital signs, they can speak, they can bleed from certain parts of their body, and they can even deliver a baby, moans and all included. So it's very unique, but I would never want you to think that we're ever substituting technology for the direct patient care. Technology is your tool and your learning resources and your comfort, so that by the time that you complete your third year here at Penn, you will be proficient in something which still seems to be very challenging for healthcare providers, and that will be inserting an IV line. Slide. Next. Okay. Again, now we are in your second year. Again, you can see the blend of the liberal arts courses along with the nursing classes. However, this will be when you will start your clinicals. So that Nursing 215 will be your first clinical, and we actually refer to it as the lifespan of woman. So you will be in a hospital setting for once a week for 8 hours a day, delivering healthcare to the lifespan of woman, but particularly labor and delivery and newborn babies. So just think, as a sophomore or a second year student, you will be actually assisting in delivering a baby, or I should say assisting in delivering a baby. Now, again, here at Penn, you're going to have hands-on experience in all type of healthcare delivery, primary care that keeps people well, acute care, which is chronic conditions, critical care, which would be your emergency department or your neonatal, anesthesia, and always emotional care as well. So at Penn, in your third and fourth year, slide, Tina, slide please, next. In your junior and senior years, you will be in clinicals twice a week, 6 hours a day in junior year, twice a week, 8 hours a day in your senior year. You are going to do 7 weeks of healthcare delivery to pediatrics, middle-aged adults, older adults, psych mental health, community health nursing, and medical surgical. Now, all these 7 weeks of clinicals will be to the completion of the fall of your senior year. Your final spring clinical in your senior year, which we refer to as your leadership clinical, is you will tell us what you may want to do. And at that point, and I'm going to use neonatal as an example, because I love to be a neonatal nurse practitioner, but I also love what I'm doing right now, speaking to all of you. But anyway, so if you are interested in neonatal, I can assure you that for that final 14 weeks, 16 hours a week, you will be placed in a neonatal unit. Now, throughout all of your undergraduate program, you have many, many opportunities. Next, please. So these are the special academic options, which really are quite unique to the University of Pennsylvania School of Nursing. Next, please. Okay, minors and majors. Well, you're going to hear me, I'm a supporter of so many things that you can do here at Penn. A minor is a cluster of courses built into your 4 undergraduate years. This is a 4-year program. So you can build a minor, and the ones that I have listed here are the ones that happen to be the most popular. Actually, the Multicultural Global Health is the most popular minor with our nursing students, but you're never limited to just doing minors within the School of Nursing. You could choose to do a minor in healthcare management in the Wharton School, or maybe you want to do a minor in fine arts in the College of Arts and Sciences. Again, it would be your choice. In addition to a minor in nutrition, we actually have a second major in nutrition. Now, a major is not a degree. A major is getting those cluster of courses, which would really give you almost as much knowledge as you would if you actually had a degree in nutrition science. But again, it's a major, and it's blended into your 4 years. Many of our students that are looking at pediatric primary care are very interested in the nutrition major, because then right now, you know that obesity crisis in children is never going away. The next thing would be, next please, would be the dual degree. And the dual degree, now this is very, very unique to Penn Nursing. We've had this dual degree program for over, I think it's about 16 years right now. And what this is that you are obtaining 2 degrees, a Bachelor's of Science degree with the nursing school, as well as a Bachelor's of Science in Economics with the Wharton School. I am always pleasantly surprised that all these years, no other school of nursing in the country has duplicated this program. So what this is doing, you are getting all the degree requirements for both schools. That's why it is definitely a 5-year program. because you're fulfilling all the requirements for nursing as well as all the requirements for wardens. Now with this unique program, the students go on to do multiple things. Some of them choose to remain in the clinical side of healthcare. Some will go into consulting. Some will go into management. Some have gone on to medical school. So there's all different options that you could possibly do with this program. But please keep in mind, as I'm mentioning, it is a 5-year program, the same as if you would choose to do with the College of Arts and Sciences. Some of the nursing students are doing a dual degree with Health and Society in the College of Arts and Sciences. However, we do have somebody that's doing a dual degree in history because they were just interested in history, again with the College of Arts and Science. But I always caution that will extend you to a 4.5 or 5-year program. Next, please. Unique opportunities. Now, we are always thinking of ways to improve our undergraduate program. So let's start with the Ben Franklin Scholars. What the Ben Franklin Scholars are, this is a university-wide scholars program. And you were invited into it at the end of March when you receive your admissions decision, as well as when early decision students receive their re-admission at the end of March. So these Ben Franklin Scholars are determined at admissions committee from the admissions officers from Penn Admissions. Now, let's say that you get your decision at the end of March and you are not invited into the Ben Franklin Scholars. Well, we never say never. So all you would have to do is contact me. I would put you in touch with the faculty director of the program, and certainly we would invite you into the Scholars program at that point. What is the benefits of the Scholars is that there are certain BFS courses, seminars, that are set aside only for the BFS students. The Hillman Scholars in Nursing Innovation. Now, this is where you're applying from a BSN directly into a PhD program. This program is an opportunity for those students that are particularly interested in research. Now, it does say you can apply in your sophomore and junior year. I always encourage students to wait and do it in their junior year so they have a better sense that the PhD in research is what they're definitely interested in. So again, you would apply into that in your junior year. You are admitted to the PhD program in the junior year. And in addition to the funding that you would be getting from undergraduate student financial services here at Penn, we offer additional funding. So on top of whatever funding financially that you're getting from Penn, we would also give you $15,000 in both your junior and senior years. But it doesn't stop there. Once you graduate, you continue directly into the PhD program, and we prefer our students to complete the program in 3 years, at the longest 4 years. However, you actually pay nothing. It is completely and totally fully funded, and in addition to being fully funded, we're going to provide you with $2,600 a month stipend for living expenses, as well as paying for your healthcare insurance as well. Now, these are things that you can just start thinking about. These opportunities are something that you have to decide right this minute. These are just an explanation of the different opportunities that you can do here at Penn. Next, please. Study abroad. I do have to say this is one of my favorite opportunities that we can afford you. We are the only school of nursing in the country that not only offers semester abroad, but our semester abroads are clinically related, which means that we would have to have affiliation with clinical health systems in another country, as well as clinical faculty. So you've seen that list of clinicals that you'd be doing in your undergraduate years. Well, you would be performing some of them in another country. And presently, we have semester abroad opportunities with Great Britain, Australia, and Israel. Now, say you come to Penn, but you're so involved, maybe you're an athlete, whatever, and you don't want to go away for a semester. That's perfectly fine, but you still want to have an abroad experience. Well, you can always do the Penn Global Seminars that are offered in the summer, because keep in mind, you are a Penn student, and so you could take part in them. So in the School of Nursing, do we ever believe in saying, oh gosh, no, we don't have anything to offer you in the summer? Absolutely not. So if you wanted to do a shorter period abroad in the summer related to healthcare, presently we offer Botswana, Africa, India, Thailand, Hong Kong, Spain, Mexico, Guatemala, Chile, France, and China in the summer. And we are always adding. In fact, I think I even said a couple that aren't even on that list. Next slide. Next, please. All right, I saved my favorite to last, and I know I keep repeating the word favorite, but that's because I'm so pleased to be able to offer you all these academic opportunities here at Penn. Submatriculation. Now, what this means is that you can apply into any one of our 14 masters in nursing. We have more master's programs in nursing than any other graduate school of nursing in the country. Now, what enables you to, and we'll stay with the neonatal theme, what enables you to apply into that neonatal nurse practitioner program is that you would have to have a 3.0 GPA. If you have a 3.2 GPA, we are actually going to waive the GREs, and that's always the way it is, not just because we're in this COVID right now, but we would waive the GREs. So you would apply in the spring of your junior year. You would know that you have been admitted in the spring of your junior year, and for your 3 remaining semesters of your undergraduate degree, we are going to substitute 3 BSN courses that also, 3 MSN courses that double count towards your BSN and your MSN, that when you would graduate with your BSN, you have already completed 3 courses towards your 12-course requirement for you to be a neonatal nurse practitioner. Now, typically, any critical care program, we do require that you would work for 2 years. And personally, I always think that you should work irregardless if you're not even considering a critical care program, because working at the bedside as a registered nurse, it's not just about enhancing your clinical skills. It's about your critical thinking, your decision-making, your people skills. So let me give you an example. So now, again, staying with the neonatal, so here you are in Children's Hospital Philadelphia for your senior leadership clinical in a neonatal unit. Now, if there is a position available in that unit, who do you think they're going to look favorably upon? A recent Penn grad? You've been on that unit for 14 weeks, 16 hours a week. So this would require you to remain in Philadelphia just a little bit longer. So now you could be working at Children's Hospital, a very nice salary as a registered nurse. Now, I, again, always recommend to students, don't consider layering on graduate courses, at least for the first 6 months that you're working, because that is a different level of responsibility. But after you've been working 6 months, you could certainly be working full-time, coming back to Penn, completing your master's degree on a part-time basis. So, big picture, you will always have your bachelor's degree in 4 years unless you choose to do a unique option like a dual degree program. Then that would take an additional year, but typically it's a 4-year program. You could have your graduate degree completed in 2.5 years part-time, and this would also give you 2.5 years baccalaureate prepared registered nursing experience. Possibly you consider building in a minor. Maybe you did a study abroad. You have to be involved in the 500 clubs and activities. Nobody gets by me without being involved in something, because that's part of the collegiate experience. And now you're probably, maybe 24, 25. Now you can go back to wherever you are choosing to practice. Now, one little caveat. Let's say during that senior leadership, you're in Children's Hospital Philadelphia in the neonatal unit, and all of a sudden you realize, wow, maybe this isn't the right program for me. Well, and you're thinking, oh gosh, but I'm already been admitted to the neonatal graduate program. Well, at any time, you can switch your acceptance from one program to another. And you know how I said that maybe you want to stay in Philadelphia to extend your time here to complete your master's degree? You don't have to do that, because we're going to hold on to your acceptance in our graduate school for up to 5 years. So you may go do whatever you want to do. You may practice. You may go home. Travel nursing seems to be very popular right now, with the luxury of knowing we are holding on to your graduate school acceptance in our program. Next, please. Okay, this is just a sampling of the nursing student organizations. I know I have already mentioned that Penn overall has over 500 clubs and activities. And I don't know if I mentioned, but I probably should, is that we will always encourage you to join these activities. You'll never hear us say to you, oh no, we recommend that you don't do that because you're in nursing and that's a great deal of commitment. Absolutely not. In fact, you want to know something? We have quite a few nurses that are Division I athletes. Now, you all have a sense of the commitment that's involved with Division I sports. But anyway, these are our nursing student organizations. I certainly encourage you to join at least a couple of them. You could join all of them if you want, but I don't think that's possible. But you should seriously consider, joining one of these programs. Next slide, please. Our advising team. The School of Nursing is actually the model for the faculty advising for the entire university, because what we would do here is that when you arrive on campus in late August, you will be assigned a faculty advisor who will be your advisor for 4 years. And in fact, you cannot even register for your classes each semester unless you meet personally with your faculty advisor. So they also serve as mentors. In addition to your faculty advisor, we have an entire team of academic advisors that I work very closely with. That say you have to have an answer to a question, that tomorrow is the last day to drop a course, you don't know what to do, that you can walk into our office 5 days a week from 9 a.m. to 6 p.m. and sit down and meet with an academic advisor that can help you guide and make some of those very crucial decisions at that point. Then we have our team of peer advisors. As you can see, that's the slide that I chose to show you is all our peer advisors. I have to say that they are the true experts. They are the ones, and you will be assigned a peer advisor at the end of June when we also help you register for your classes for the fall, so that these students, as I mentioned, are true experts. They can tell you, oh yes, well that college has its air conditioning, but I recommend that you bring a fan anyway. So they have all those questions that we cannot really answer as well. Next, please. Okay, so that's all my contact information. That's my name. That's my phone number. I receive phone calls all the time that go right to my computer, and I promise you I return phone calls and emails. My guidelines are within 2 days, no longer, because I know how anxious you all are and how important these questions are. Also, I would like to extend to you is that if you wanted to do a one-on-one with me, email me, and we can set up a Blue Jeans meeting or a Zoom meeting. Where it would be I'd like to refer to it as I can help you plan your life, particularly planning your life here at Penn and the future in nursing. So all you have to do is email me, give me a few days and times, and I promise you I will respond to you with an ID number, and we'll have an opportunity to speak. In the meantime, I am always available for questions. I certainly know how challenging this time of year is for you. It's challenging in normal circumstances, but with the coronavirus, it's even more unusual circumstance. So never feel that you were ever bothering me or that any question is too small. So I truly hope that you consider Penn, and particularly Penn Nursing. And again, good luck to you.